Hello, my name is Jennifer Mills, and I wanted to talk to you a little bit about quality control um, at Regional West Medical Center inside of the medical laboratory. And so this presentation is designed to go over some of the topics that are involved with quality control, especially when seeking CAP accreditation. So when I'm making presentations or recording myself, I find it a little easier to kind of list out what I'm supposed to talk about so I don't get distracted or go off on unrelated topics. So I kind of put a couple of little bullet points so I can keep on track and you can keep on track with me. Um, as far as the quality control team within the laboratory department at Regional West, is a little different than a standard quality control and admin because the medical laboratory has a lot of standards that they have to follow that's been outlined by the federal government. So in order to perform patient testing, we have to meet certain standards and we have to be accredited by either CAP or COLA in order to meet those standards. So the purpose of our team for quality control in the lab at Regional West Medical Center is to support the accreditation program CAP. CAP is the College of American Pathologists, and this is a program that's supported by the Centers for Medicare and Medicaid, CMS. All hospital laboratories need to be accredited through CAP or COLA. COLA is the Commission on Office Laboratory Accreditation, which is an equally rigorous accreditation program, but not the one that Regional West subscribes to. And the purpose of having this quality control team for CAP is to engage in the overall continuous improvement in patient care. So that continuous improvement, quality improvement is something that the lab also strives for. And so to kind of continue talking about the purpose of this team, I kind of need to talk a little bit about CAP. Um, their website gives a really good checklist um, that kind of talks about the things that go into checking for quality assurance in certain departments. So when I pull up this list, they've got all the different departments, and that would include hematology, chemistry, microbiology, blood bank, immunology, urinalysis, coagulation. And so each one has a specific checklist that CAP kind of goes in and looks at to make sure you're meeting all those quality control and insurance points. So when I'm looking at the hematology and coagulation area, to give some really good examples of what we do, what we report on for our quality, we'll look at CBCs and differentials. Those are the little slides with blood smears on them. And we'll ensure that both the automated and manual procedure meets standards. We look at like retics, which are immature red blood cells. We make sure that the procedure for looking for retics is up to date and up to standards with the College of Pathology. We make sure that there's a manual provided in every department for all techs to refer to when performing procedures. So if there's no manual, we're going to miss that point on the quality control checklist. We're going to look at routine coagulation, the way we store specimens, if we have logbooks, if we're recording temperatures every day. So all that kind of stuff CAP will look at for quality inspection. And so, every quality assurance team has certain members that you work with. There are many different types of quality control, again, at Regional West. And for this specific CAP survey and lab accreditation, we kind of have a certain hierarchy that's involved in this process. Of course, our Chief Executive Officer, Mel McNay, he is at the top of this pyramid, so to speak. And then we have Margot Ferguson. She's the Chief Quality Officer, and so she oversees a lot of the different quality assurance programs here at Regional West. And then we go down to Erica Carmody. She's the director of nursing right now. And then we've got Dr. Sarazan. He's the chief medical officer. And then we have Craig Krentz. He's chief network executive. And he specifically has been assigned lab. So when we're talking about our lab directors, we report to Craig Krentz. And then it goes down to the laboratory department leaders, and so there's several of those that kind of work on this CAP accreditation. And they're going to be more closer to being on the bench and familiar with the different practices inside of the lab. So a couple other leaders for the lab department leads right now would be Kelly Ramirez. She's the director. We've got Julie Dollinger. She's lead. She usually hangs out in micro and blood bank. And then we have Caitlin Bergfield, who's another lead, kind of like a shift lead. It's important to note that this is a very multidisciplinary team. Each of these folks has a different background in healthcare, whether they come from QA, admin, we even have nursing, we have MD, pathology, and lab on this team because lab is used in every area of medicine. And so by having this diverse team, we can touch on every aspect of the total healthcare experience, as well as seek accreditation through CAP. And so the whole point of accreditation through CAP is to ensure quality assurance for laboratory practices. These examples of the multidiscipline area of lab includes testing, reporting, and specimen processing, transporting the specimen, how labs are collected on the floor in clinic after surgery. So all of that broad-based medical practice is included in the CAP quality assurance program and accreditation, and we need to have a diverse QA team to meet every standard of that process. So moving on to team collaboration and what having a diverse team entails is the ability to collaborate between one another. And when we use collaborative decision making at Regional West, we are making that whole process possible by having two types of decision making processes. One is the collaborative decision making process, and the other is shared governance. So with collaborative decision making, we're talking about all the leaders coming together in a meeting and making decisions. But perhaps more importantly is shared governance. That's a little different than collaborative decision making. That's when the leaders are working with the techs on the floor and medical professionals on the floor to obtain real input. And this input comes from the bench in laboratory, and that's how they're taking information and incorporating it into what needs to be done to improve the quality of laboratory services at Regional West and a lot of different laboratories in the country. And so that brings us to what's the outcome of having CAP accreditation? Well, CAP comes in and looks at your lab. They take a look at all your manuals, they take a look at all your QA, they take a look at all your QC, and they're looking at your logbooks, your temperature logs, they're looking at your processes, whether you have them documented. And the purpose of this is to identify problems. So there's no such thing as a perfect lab, and there's no such thing as a perfect hospital. And that's why we're always striving for continuous improvement, right? So you're going to get a lot of feedback from your CAP visit. So they're going to identify problems and they will find one. But more importantly, they're going to give you a plan to correct that problem. So these are the experts. This is why they call them the College of Pathologists. They're the experts. They've run into all these problems. They're working collaboratively with labs across the nation and in some cases across the globe. So they have a lot of tools that can bring in new information, new ideas, and new processes to our laboratories. Another outcome is, obviously you're going to get accreditation after a CAP visit. And that's meeting a gold standard saying that your laboratory is good enough to be providing laboratory services for your patients, because we all know that around 70% of all medical decisions are based on laboratory results. Um, Using this quality improvement kind of plan outlined by CAP is going to help maintain the accuracy of test results. We're going to ensure accurate patient diagnosis. We're going to make sure that they meet those clinical laboratory improvement amendment standards. That's the CLIA 88. That's a federal rule stating that your laboratory has to meet certain um, milestones in order to be considered a lab and allowed to operate. This was all outlined by the FDA and the federal government in 1988. We're also going to make sure we are meeting OSHA standards, because there are employees that work in the laboratory every day, day in and day out, and it is considered a work environment. We work with a lot of hazardous chemicals and pathogenic specimens that could be hazardous to health. More outcomes of seeking CAP accreditation and this utilizing this quality control quality assurance program is it's going to help the lab evolve with all the rapid changes. And so by enlisting to a continuous quality control program, we're going to stay ahead of the curve. We're gonna keep current with all the new information they're learning over there at CAP, and we're going to incorporate all the other practices and things that other laboratories have learned for what we call as best practice. This is that peer information utilization aspect of CAP accreditation. And then finally, what enlisting in CAP helps us to do is to give professional development feedback and learning opportunities um, within the lab itself. Here at Regional West, our most recent CAP accreditation was in April 2023. And so we're going to be due one not this year, but the next year, because you need to do this every 2 years to stay current with CAP. So thanks for listening. If you have any questions, just get a hold of me through Blackboard, use the message system, and have a great day.